problem ostundi puttinappudu. So in the Southeast Asian countries and the India, the problem, the burden is even more. Now, why we are discussing about cochlear implant is, you know about pacemaker, knee implant, many other implants are there in human body. Among them, cochlear implant is one of the most successful implant. Reliability and the success rate is 99%. So the technology gives excellent result. Now imagine a child, so when a parents come to me at the age of 3 years, 4 years, నా పిల్లలకి మాట్లాడొద్దు ఒక్కటి కూడా శబ్దం లేదు, సో దే ఆర్ highly emotional, they're anxious that what is the reason. And in society there is a myth, they tell me, ma'am, guntulo emi problem unda, kondunaliki problem unda. So they don't understand the problem is the child is not hearing. Hearing lakipote shabdam radu, language skill radu, the problem is in hearing. But to understand that, they are losing important 3 years, 2 years just to come to the doctor to ask this question. So the purpose of today's press meet or to raise the awareness in the society, if your child is not saying a word by the age of 1 year, if your child is not able to say a sentence by the age of 2 years, please do not delay. Do not think that another 6 months will wait and then go to the doctor. Please come to your pediatrician or ENT doctor or audiologist like Mr. Sandeep. This kind of specialty, we can detect where is the problem of the child, because earlier we detect, we can do something. If the children come after 5 years, even though we do cochlear implant, పిల్లలకి లాంగ్వేజ్ స్కిల్ మంచిగా రాదు. దిస్ లాంగ్వేజ్ స్కిల్ డెవలప్మెంట్ గురించి early intervention is needed. Few points about history of cochlear implant. First cochlear implant was done in California in the year of 1961, but it was successful, but it took few decades to get it in commercial market. Lot of research, lot of scientists, doctors worked behind this. Then in Australia, the next successful implant was done in around 1978, which was successful. 1985 onwards, this came into commercial market that people can make use of it. So in that way, it is a young device, 30 to 40 years in the market, but it is doing excellent. 2022 data worldwide, there are around 10 lakh implant recipients. So the scope is increasing day by day. More people know about the problem, then only we can help them. Yes, it is a costly device, but each state government, central government, there are many NGOs. Medicover has tie-up with such NGOs. So we are, all the children you are meeting today, they are our free candidates. We have done 25, but we call the kids who got the implant free of cost. The whole treatment process they got free of cost. That is because of Medicover's effort and the NGO's help. So basically we need more people to approach us, and then we can channelize that how we can help them. About the selection of the centers, very few centers in whole India, maybe around handful, maybe 100 centers are well equipped to do this kind of surgery. Why? Because when we operate on small kids, there are a lot of risk factors associated. చిన్న పిల్లలకి ముత్తు డాక్టర్ కావాలి, అనస్థీషియా డాక్టర్కి ఎక్స్పర్టైజ్ కావాలి. It is not easy to put a child of 1 year or 2 years old who cannot hear, who cannot speak, to put under anesthesia, operate them, make them comfortable. So the doctor and the team has to build a rapport with them. So we have a team here, myself, Dr. Sampurna, my teammates, Dr. Alina, Aishwarya, Mr. Sandeep has a team here. So we have a full team of 5-6 people who work on this. Along with our anesthesia doctors are expert in giving pediatric anesthesia. Medicover has a woman and child branch. We have 24 hours pediatric doctors coverage. That is why this kind of institute can take care of this kind of program. And the second thing is, we have to build up a relation with these families. If you talk to any of these families, they know me and my team for at least 6-7 months by now, and maybe they will be in touch for lifelong. So this is a lifelong commitment. It's not that we do the surgery and we forget the patient. We call them for follow-up. If they are missing, we ask them what is the problem, why you are not coming, how we can help you. So this lifelong commitment is needed. So a very good team of ENT surgeon, audiologist, therapist, then only, and with a good setup of hospital. We have high-end microscopes, debriders, all these modern equipments are needed, and that is how we have been successful to do different kind of implant candidates. We have also done for many international patients from Yemen, Somalia, Sudan, Tanzania, and all these people come to India to get this surgery done. and we keep hoping that we do more such cases and help more people by doing this surgery. Thank you.
Then what could be the time?
What is deaf? What should not be used? With profound hearing impairment, 90% parents are normal, but the children are born like this. So many of them are genetic reason. One reason is there may be sudden mutation in the gene that the child was born like that. Many of them have history of consanguineous marriage within the same family, cousins, or that is not good. Many, yeah. So correct. So some genetic diseases get manifested if the marriage happens within the family, and some of them will be because of some infection the mother suffered during pregnancy. Pregnancy time lo cytomegalovirus, rubella, mumps ilaga infection hoste babu ki inside the uterus only the ear does not develop properly. So when we see these kids, we do their audiology assessment, CT scan, MRI. By seeing all these things, we can give an idea. Okay, this child probably this is the reason of getting this kind of problem. So there are different reasons behind it.
దీన్ని ఇప్పుడు అవేర్నెస్ ప్రోగ్రామ్ ఎట్లా ఏ రకంగా చేస్తుంది?
There are NGOs who visit all the district level hospitals and school awareness program. Through these, we try to raise the awareness that early intervention is so important.
ఎన్జిఓస్ అటాచ్డ్
NGOs?
ఎన్ని ఎన్జిఓస్ మీరు?
In all India, there are a lot of NGOs. In Hyderabad, we are currently working with Ashra Equity, which is a Hyderabad-based NGO. They have been working on this field for many years. And it is not only for congenital. Suppose age-related hearing loss. Somebody's father, grandfather, 70 years old, 80 years old, hearing chala taggindi, normal hearing aid to benefit radu. They are also implant candidate. That awareness is also not there in society, provided the person is fit. There are many people nowadays, aged population is increasing. Day by day, we see people are in their 80s, no heart problem, fit and fine, but they are not able to hear. So they are compromising their life. There is no need to compromise. First, there are a lot of advanced hearing aids. If hearing aids is not working, there is cochlear implant. So we have also done in geriatric population, in adult population. We get a lot of Middle East patients who lost hearing due to some, war, bomb blast, some kind of gross injuries at any age. They can also be implanted. So I would say this is the only device which can replace the sense organs. We have 5 sense organs like eyes, skin, ears, and the touch and the smell organ. It is the only organ, that is the hearing organ. If somehow child is born with deafness or became deaf because of some reason, with the technology help, we can give it back. That is the miraculous thing.
One picture like
Thank you.
You can also have device picture. Shanmuk's sister was crying somewhere outside. There's a bomb. She has already started speaking. All these children, they had no language at all. As they can't hear, they don't speak at all. Now they are speaking, they're understanding. So completely life changing.
ఇన్స్ట్రుమెంట్ ఉంటేనే మాట్లాడేది.
Yeah.
అంతే వీళ్ళు ఉంచుకుంటారా అది?
See, at this early age, till 3-4 years only, a person can learn language. So we have to implant within that age. Then give therapy, they will slowly come up and she'll come like you and me. But
ఇప్పుడు వీళ్ళు ఏజ్ పెరిగినాక చేంజ్ చేసుకోవాలా?
no, continue.
ఇంటర్నల్ ఇంప్లాంట్ కంటిన్యూ, ఈ ఎక్స్టర్నల్ ఉండే మిషన్ మాత్రం
అదే
వాళ్ళు మార్చుకోవాలి.
అదే
మన అద్దాలు
ఎందుకంటే ఏజ్ పెరుగుతూ ఉంటుంది, మెచ్యూరిటీ వస్తూ ఉంటుంది.
No, not because of maturity. facility. If they want, they can live with this for lifetime also.
Okay.
But if somebody wants to take newer technology, suppose you had a Oppo phone, you want to buy iPhone. That's like that.
Okay.
You have money and you want to upgrade, then they can upgrade. Even if they don't upgrade, they will be able to hear with this. Basic hearing will be maintained with this. So, sir, which has a waterproof casing, with that they are swimming. So there are children who are now somebody has become engineer or fashion designer who have been implanted in early ages. They will go to different school, right? It is difficult to get job, if they can't communicate with the family. The whole family goes in depression if a child is born deaf.